blog manager at HealthyPlace. I also write the Breaking Bipolar blog there and my own personal blog, Bipolar Burble. Today, we're going to discuss the challenges of mental health and mental illnesses during this really challenging time with the coronavirus, also known as COVID-19. I'll be introducing our guest in just a minute, and then I'm going to do a short interview with him, and we'll open up the floor to all of your personal questions, which I really want to get answered. So as we go along, please feel free to comment in the text box, and I will get those questions. So our guest tonight is Dr. Harry Croft. Dr. Croft is a board-certified psychiatrist, and he is the medical director at HealthyPlace. He's been in private practice for over 40 years. Over that time, he's conducted over 50 pharmaceutical industry clinical trials and has published his findings in the leading scientific journals. Dr. Croft has specific expertise in PTSD. Good evening, Dr. Croft. Thank you so much for being with us tonight. So with what's going on with the coronavirus, these are very anxiety-provoking times, and they're very challenging, especially for people with mental illness. Would you agree?
Absolutely. I've spent most of the day doing media interviews on the anxiety caused by what's going on now with the virus. And that did not involve those with already diagnosed mental conditions. And so what we're going to talk about tonight adds an extra layer to that already existing anxiety.
Absolutely. I want to focus on the mental health and treatment of people because so many people right now are isolated. They're in their homes and they're in their businesses, or they're in their homes because the businesses are closed, and even getting to see a doctor might be impossible for them. So in addition, many people are worried about their jobs, another major challenge for people. So tell me, how can they keep their symptoms from worsening over this time?
I wish there were a simple answer I could give you and tell everybody, just do this and everything will be okay. Unfortunately, such a simple answer doesn't exist because there's so many different features of what we're talking about, and different people experience their mental illness in different ways. And so there's no one piece of advice that I think would work for everybody, but here are some general pieces of advice.
Great.
Number one, control whatever it is you can control. Mm-hmm. Most people are so busy worrying about the things they can't control that they forget there are things that are within their control, and doing those things may decrease the anxiety. For example, the social distancing we're talking about, washing the hands, making sure you understand the symptoms of COVID-19. That is a fever, anything. This is ever changing, as everybody knows. It used to be over 100.4 was considered symptomatic. Now it's anything over 98 point something. But okay. Certainly, if it's above 100.4, that's a symptom. A dry cough is a symptom, and fatigue is a symptom. And that varies, as most people here will know, from the general flu, where the symptoms are more a wet cough, aches and pains, maybe a high fever, maybe not. But this generally has the fever and the dry cough. So understanding the symptoms puts people in better control. And then you can follow the recommendations of the CDC in terms of what to do if you have those symptoms. And in general, it involves calling your physician and trying to find out what the next step is. Is it to get a prescription for a test? Is it to go to some clinic for about further evaluation? But again, follow those instructions. And doing so, putting yourself in some control helps. Taking as best care of yourself as you can. I mean, it's hard for some people to normalize sleep, but the more you can normalize your sleep, the more you can eat properly, the more you can exercise, the more you can stay in contact with some sort of support system. And these days, it's probably over the phone or over the web. But doing those things gives you some sense of control.
Thank you. I think that's a brilliant idea. I think focusing on what you can control is something that we haven't actually heard a lot about. So thank you for bringing that up. So my next question for you is, most of us are on psychiatric medication, myself included, things like antidepressants, antipsychotics, and they have serious withdrawal symptoms if they are suddenly stopped. So, what can a person do if they can't get their medication right now because the doctor's not available, because the medication's not available, because of whatever reason? What can I do, for example, if I can't get my antidepressants?
Okay, let's go back one step. And that is, don't wait until you've run out of medication to start attempting to figure out what to do. So now, if you have medication available to you, I would call my psychiatrist and just say, look, I'm just trying to make contact now because I realize we don't know how long this thing will last. And I want to check out with you. What should I do? Should I run out of medication, or should I develop symptoms that I don't have right now? How do I get in touch with this office? And I'll tell you, I've been in practice a long, long time. And my real recommendation is call the psychiatrist office and try to talk to the nurse practitioner or the PA or someone, the therapist in the office, even though they might not be able to prescribe medication, they may be the point of contact to get in touch with the psychiatrist or the physician. And so making contact with them now gives you an open line should you run out. What do you do if you do run out? Well, I don't know that there's a perfect answer. I think you keep trying to call. Probably, if you can these days, I would text rather than call, because I've learned it's easier for me to respond to text than to phone calls, and that might get you through to your provider more quickly. What do you do
Great.
if you absolutely do run out? Well, there are a number of not great options, but at least there are options. One is maybe cut down the amount of medication you're taking for right now. Not over the long term. That's not a good suggestion for everybody. But in case of an emergency, it may be a good suggestion. If you're taking medications that have long half-lives, how do you know if your medicine has a long span of action in your body? Google it and see, go to WebMD and see how long does your medication generally last in the body. If it's got a long half-life, that is, it stays around quite a while, you may be able to drop your medication to every other day until you can find a way to get in touch with the psychiatrist and get the medication. Um, going to a support group, calling somebody in a support group, the bipolar disorder support group, the Mental Health Association support group, all of those things might give you some options in your community that you might be able to call. And then the last option is it's called the center, your MHMR authority. It's called different things in different communities. Here in San Antonio, the Center for Health Care, CHCS, Healthcare Services, it is the mental health, mental retardation organization that you might want to call and go to.
So it would be a state-run mental health organization.
State or county,
Okay.
or, someplace that provides services for those with mental health conditions. And again, they may not be able to help you directly, but they may be able to make some other suggestions, knowing the people in your community, in terms of how do you get in touch with them.
And I just want to go back just 1 second about half-lives. Now, I want to mention for people who don't know, medication half-lives, as Dr. Croft said, are available online, but specifically they are on Wikipedia. So Wikipedia tends to have that information without any trouble. But I want to ask you, what is a long half-life and what's a short half-life?
Yeah, so if the half-life is somewhere around 24 hours or longer, it's a long half-life. And the point of that is that if you missed one day's dose, you might not have discontinuation symptoms. The drugs that have a half-life of 12 hours or less are more likely to produce discontinuation symptoms if you forget a dose or miss a dose. But you do the best you can.
Yeah. Okay, great. Thank you. So what do you do if your doctor isn't accepting appointments, but you need to see a doctor? I know we talked about that briefly, but who's the first person that you contact if you can't see your own doctor?
What I would do here in my community, and again, each community is probably different, but here in this community, as a guideline, I would call the mental health authority, what we used to call mental health, mental retardation here, MHMR. It goes by many different names, but it's the county or the city or the state mental health authority. And I would call them and explain, look, this is my problem. And the physician that I normally see isn't taking appointments right now. In fact, their offices are closed. I just need some guidance in terms of what to do. Here in San Antonio, that authority, the Center for Healthcare Services, has an emergency facility that people can go to, as opposed to going to a hospital emergency room, and they can be seen fairly quickly. So
great.
Some place to start.
So I just want to encourage anyone out there to leave a question with us. Dr. Croft is happy to field questions, and I'm happy to throw them at him. So go ahead and leave a question, and we'll make sure that it gets answered. So in a mental health crisis, we all know in a mental health crisis, there are a few things that we can do, like go to our doctors, or maybe call 911, or maybe go to a hospital. But these are very special times with special things going on right now. So So if I have a mental health crisis and I feel like I need to reach out because I am experiencing psychosis or because I'm acutely suicidal or something like that, what's your recommendation there as to how to reach out? Is it the same? Is it different?
I, I think it's probably more the same than it is different. You can call the usual 800 numbers if you're suicidal. Uh, you can call one of the local psychiatric hospitals, perhaps. Even if it's a private psychiatric hospital and you don't have the kind of insurance that would enable you to go there, most of those facilities still have emergency triage over the telephone. And so it may be a good place to get started. Even if they're not going to see you there, they may have access to other places that are free or reduced fee that you might be able to go to. So I'd do that. I'd of course call the local university, hospital, whatever the local hospital is, to the emergency room and ask questions. And again, the mental health, mental retardation authorities. I would check in today's environment. I would
Mhm.
know your temperature. Do you have a fever? Is it
Okay.
over 100.5? Are you suffering from a dry cough? Are you having inordinate fatigue? Because they may want to know those things before they invite you to come somewhere to be seen, to make sure you don't suffer from the coronavirus right now and might put others at risk. So knowing those things before you make the emergency call may be of value to you.
Okay, that's a really great tip. So, I do want to know what else people with mental health conditions should be aware of in terms of managing their treatment in this very special environment that we're in right now.
So understand that I believe we're going to get past this. This too will pass. We've been through other crises like this during my lifetime, other viruses, other illnesses, and the viral illnesses have a usual pattern where they peak and then they improve. That happens more quickly if we have treatments, and as most of the people watching this will know, they're working on treatments which have been tried in other countries and tried for other conditions. If we can develop a medication or a treatment which takes care of the illness, that would be best. Uh, we're working on vaccines, but the vaccines take a longer time to be developed and to produce effects that'll be of value right now. But they're working on those things, and the best thing we can do right now is to follow the CDC guidelines, do the social distancing. That, by the way, doesn't necessarily mean that you stay cooped up in your room or your apartment or your home. People can still go outside as long as there's a distance between them and other people. But the idea of these guidelines is to keep the viral illness under the best control we have, because without that control, it peaks, and it
Mhm.
peaks generally quickly over a short period of time. Um, it generally goes away, and many of the people watching this will know that most people have rather mild illnesses. The exceptions to those are the elderly, those with lung disease, those with other illnesses which worsen their immune system, things like cancer or other autoimmune diseases. So the idea is if we can keep that peak from peaking and instead kind of flatten it out so fewer people contract the virus, that gives us more time to find ways of dealing with it and makes it less likely that we will overwhelm the medical care system. What does that mean? Well, if too many people have this virus and have to be hospitalized, we could run out of hospital beds. And if they get severely ill, and remember, not everybody who acquires the virus gets severely ill, but if they get severely ill, they may have to be hospitalized in the intensive care unit. Well,
Right.
there are not a lot of beds in ICUs. And so if we get too many people that need the ICU, we may not have the space to treat them in our hospitals. They're working on that now. What other things might we do? And then we may not have enough ventilators because this virus affects the lungs, and especially in the older people and so forth. And we may not have enough ventilators. And so if we run into that problem, we could be in the same position that Italy is right now, that they don't have enough ICU beds, they don't have enough ventilators, and that can be disastrous. So we need to follow the guidelines. That's number one. Number two, realize that this particular illness can be anxiety producing, but it doesn't of necessity worsen the other mental illnesses, whatever they might be it bipolar or depression or schizophrenia or anxiety disorder. It doesn't necessarily mean that those conditions will worsen. They might, but they may not. And so I think it's best if we make the assumption that we're going to do everything we can to handle our underlying condition, whatever that is, and then take all the actions we can to control our coronavirus fears.
Thank you very much. I think that what I really want to know is, does having a serious mental illness, bipolar, schizophrenia, whatever it is, does it actually decrease your immune system? Does it put you more at risk of getting an illness? Or does it have no effect at all?
So I'm not
Is that a
sure.
hard one?
I'm not sure we know the answer to that.
Okay.
We know a lot more now about the role of inflammation in mental disorders, bipolar, depression, schizophrenia. We know that it may cause increased inflammation and therefore reduce the likelihood of dealing with some immune conditions. But I don't know that we know exactly. We also know that, we worry about people with mental illness getting worse overall. Sometimes people with mental illnesses pull it together when they have other external things to deal with and actually do better.
That's great to know.
So we need a hope for that as well. One of the things I mentioned earlier, but I want to mention again, if you have a support system, whether that be people that you call on the phone or people that you contact through social media or otherwise on the web, do it. It may not help you, but it may help them. And in helping someone else, you may help yourself.
Well,
And
that's actually a really, sorry, I hate to interrupt you, but we do have some questions from the audience.
go for it.
So it actually brings us to a great question by Melanie. And she says, I'm taking antidepressants, but I'm feeling best now. So she asked, can she take more than what was prescribed for her?
So I lost a little bit in the middle, but I assume Melanie's question is she's taking antidepressants for depression, but because of all this, she's actually feeling a bit more depressed. Can she take more of the antidepressant?
Correct.
It's not an easy question because we're all different, and I don't know the dose of the antidepressant she's taking. Is she already at a pretty high dose, making it more likely that adding more either A isn't going to make it any better, or B may cause more side effects or more problems? I think a better way to probably handle it is to try to get in touch with some mental health provider, especially a therapist, a nurse practitioner, PA, somebody that will talk to Melanie and maybe give some suggestions about how to deal with the increased symptom of her depression. And we all know that cognitive behavioral therapy, we all read about that as being one of the ways to handle depression. And there's some very simple cognitive behavioral techniques that people can use to question their own thoughts. Maybe it's those thoughts that are causing the worsening of depression, and just by using the cognitive behavioral techniques, and you can Google those and see what they are, that might help. You can look on HealthyPlace. There's a lot of information about cognitive behavioral therapy. Sometimes things like mindfulness or meditation or relaxation therapy or increased exercise, all of those things can lessen the amount of depression, and maybe a change in medicine is not necessary. I always think one adjusting their own medicine, unless you've talked to your mental health provider or physician about it, is probably not a good idea.
So now we've got one from Kelly, and Kelly asks, will the COVID-19 symptoms affect my medications? So I guess this is in the case where you do contract COVID-19. Will that affect your medications?
The answer is we don't know. This is too new a virus, and we don't know exactly everything it does. I mean, we've not dealt with this virus but for the last several months, and it's not been well studied. If we look at other viral diseases, generally they don't affect the medication, but they may well affect the symptoms you're having, so that you don't know whether it's the decreased effectiveness of the medication or whether it's just the worsening of symptoms caused by not feeling well.
Mhm.
The good news about the COVID virus, as we understand it, or at least as I understand it now, is that it peaks very quickly if
Okay.
it's going to get better. The fever may get very high and may shoot up to 103, 104, but most people have said then it kind of goes down pretty quickly as well. Now, the problem is it may affect the lungs or the immune system, and that might worsen your condition in some other way.
So now we've got one from Diana, and she says, dealing with coronavirus and having bipolar disorder and anxiety disorder, hi, just like me, um, it makes these.
And you know what? I love it that you're so open and so sharing about your illness, because I think you help a lot of people who just otherwise just would be overwhelmed. Uh, Let me just tell you, I'm going to have to run in just a minute. But
Okay.
my wife just had total knee replacement surgery 3 weeks ago. For those of you who don't know about that, it hurts like hell. And it causes swelling and it causes discoloration, and you can't bend your knee and all that other stuff. And what I'm getting to is one of the things that's helped my wife the most is she found on Facebook the total knee replacement support group. And
Great.
it's a support group that you have to be invited to go, and that means they kind of look over it. They don't censor everything. But the point is, learning from people in that group who have been there and done that and can say, you I know it seems today that your life really sucks and it's not good, but just hang in there because I was where you are. That has helped my wife a lot. And I know in the same way, your openness on Healthy Place and your books and everything has helped others as well.
Well, thank you, Dr. Croft. I certainly appreciate your words. Do you have time for just one more?
Yes, ma'am.
Okay. So Barbara says she has therapy tomorrow, but it's going to be over the telephone. And she's never done this before. She's only done face to face. So she wants to know what to expect from that type of therapy.
Uh, it will be different at the outset. And have you, I don't know if she's seen this therapist in the past, but this is the first time via the telephone she's seen the therapist. If she's seen the therapist in the past, the discomfort will pass very quickly, generally. And then it's just like talking to them face to face. Many states, including my state, has now increased the availability of telemedicine so that people can be seen over Skype or over the internet. And that's even better because you can then see the facial response and the therapist can see her facial response. But look, if the option is don't do nothing or do it over the telephone, the answer is absolutely do it over the phone.
I totally agree with that. So, do you have thoughts on the idea that the environment that we're in will naturally make anxiety worse? If you have anxiety with bipolar disorder or with or with just generalized anxiety, do you feel like the environment that we're in is just naturally going to make that worse?
For a lot of people, yes. For some, it may have just the opposite effect. Now they've got something else to project their worries on and may feel better and may do better. But in general, like I said at the outset, I've been speaking all day via media around the country about the anxiety produced. And there are a lot of anxiety provoking things about this virus, the medical part, the isolation that some people feel, the financial part, all of those things may worsen the anxiety in some people, but not necessarily. And again, remember the mantra, I can do better if I can control the things that are within my control and do that.
Okay. I think that's something I can definitely take away from our conversation, and I really hope that our the people who have watched you today also can take that home and find things that they can control, be them tiny, be them huge, but to find those things and to help that reduce the anxiety that I know I'm feeling and that I know a lot of people are feeling right now. So that's a really great thing to take. Thank you so much for talking with us today, Dr. Croft. It's been a pleasure.
Thanks. And it's always good seeing you and always good to do Healthy Place.
Okay. Have a great evening.